At Health Watch we take a lot of calls every day from people that are struggling with various issues, health, care and well-being, and their situations are complicated. They're finding it hard to find a way to make progress, to make things better. And I think what Carrie showed tonight is that there are some very simple things, simple changes that can be made that may not cure everything in life, but actually can start to make things a little bit better. And there are very few things that can cure everything. It is about finding small things that gradually make things better every day. And I think cumulatively, if that could happen, then obviously it would have the level of impact that she's hoping for. I think mainly in the fact that we are talking to members of the public every day as well as professionals, and we give them a bespoke service. We take the time to listen to them and find out what's going on. So, if the exercises, the re-education is something that will be appropriate to them, then there's no reason that we couldn't make those suggestions and just have that discussion with the individual.
Well, I did think it was pretty thought-provoking. It's made me rethink how I operate as a person. I do have a spinal problem as such, and I know that I do slouch on the settee, and it's certainly given me food for thought to actually consider how I sit down. I still try and put things on standing up and nearly fall over, and that was a very valid point, that why risk falling over when you can actually sit down and do it in a different way. So I will take that on board. Because when you think about the strain on the National Health Service, it is ridiculous when a lot of those visits could be prevented for all the reasons that she said tonight, all the add-ons you need if you have a hip replacement, for example. A lot of that can be avoided if you manage how you live your life. So yeah, definitely thought-provoking.
So I lead a lot on project management, but one of the most important areas that I lead upon is preventing deconditioning in hospital. So a lot of what Carrie is discussing and describing is also being quite impactful in the hospital and how we can stop patients from getting weaker during their stay by promoting them by being more independent and more active throughout their recovery. It speaks volumes to me. It's the kind of thing that I've been trying to lead upon and support in the hospital, but also, as she's saying, more preventative in the community and how we can prevent those patients from coming in the first place. So lead better quality of life and improve their quality of life. Although my work could be considered quite reactive, there's still area for it for when our patients do come in to understand the importance of keeping strong. Adopting good posture even when sitting out in a chair, or even just walking to and from the bathrooms rather than maybe using commodes by the bedside or things like that. So there's a lot of work I could do there, but also a lot of work that I'd like to help her with in terms of getting into the schools early and the colleges or other areas to just really promote the element that movement is one of the most important things to promote recovery and better health.
I thought it was very interesting. I think education is a responsibility of us all. In terms of our leverage of our membership of 10,000, I would assume that we could play a role both in campaigning but bringing those good habits to many of our therapist clients and embedding some of those practices and that theory that Carrie is talking about. So I think we have a big role that we could play to work together with Carrie to make a change and to influence policy and decision makers and how we get the levers that ensure that people in power actually start acting on some of the good advice in the film and what Carrie is trying to do with children and young people so the next generation can be pain-free and live a more fulfilled life. This is just a sort of thing from an educational point of view, and we run an educational program for students as well, with therapists new into their career. So we would be very interested in trying to move that with Carrie. My name's Conrad Hollingsworth, and I'm the Chief Executive of the Federation of Holistic Therapists. I'm delighted to be here at today's Carrie's launch of a tremendous work. Carrie's been a FHT member for over 20 years. We're very supportive of the educational programme that she's putting on for the young people and trying to get the next generation free from aches and pains with her sterling work. As I said, we're proud to have Carrie as an FHT member. The board are fully supportive and we look forward to working together with her in the future. Carrie, from everyone at FHT, all our board, our supporters, our members and everyone involved, we're very proud of you and thank you very much for starting this very important piece of work. Thank you.
Oh.